quite like the idea of having some florals in the background.
Yeah.
Family's everything to me, and it was to my husband. We have obviously achieved, both of us, quite a lot in our lives, but the greatest achievement at all is our family, our children.
For Jill Rivers, her daughter's upcoming marriage will be a bittersweet moment.
We are obviously very excited about the wedding, but there is also that overlying sadness of my husband not being there to walk his daughter down the aisle.
I think there's a common misconception that your family's going to be fine, that your loved ones are going to be fine, when in reality you have to be so careful, and we don't really know the extent of what this virus can do.
Jill's husband, 69-year-old Jeremy St John, was looking forward to celebrating with his family before he was rushed to Melbourne St Vincent's Hospital with COVID.
It was only within 24 hours of his admission that I received a call in the middle of the night to say that it might be a good time for me to come in and say goodbye to Jeremy because he was still lucid and he was going to die. Because it's a COVID ward and COVID times, we couldn't go in as in a normal situation and hold his hand and talk to him.
While Jeremy was up to date with his vaccinations, he'd only had 2 when he died in December.
It was such a shock because Jeremy was not a person that you would think would be in the category of someone who was going to die of COVID. He had just turned 69. He didn't have any health issues that would lead to his death.
Nationally, there's been a surge in COVID infections this year. That's seen the number of people hospitalised increase, while the proportion of people ending up in hospital is higher than it was in January's Omicron wave. The number of deaths from COVID-19 has also been on the rise, recently hitting 10,000 lives lost.
And I think without the major restrictions and major actions that we took in 2020 and 2021, if we had an equivalent death rate to, say, the UK or the US on a population basis, we'd be looking at 50,000 deaths. So, glass half full, we've prevented many, many deaths. But glass half empty, 10,000 people have lost their lives, which is always a tragedy.
Of those infected with the virus in the past 6 months, unvaccinated people aged under 49 were 22 times more likely to die compared to those who'd had 2 or more doses of the vaccine. For people aged between 50 and 69, the unvaccinated were nearly 37 times more likely to die, while in the oldest age group, the virus was 16 times more fatal for the unvaccinated. Epidemiologist Greg Daw has followed Australia's COVID outbreaks since the beginning.
What we're seeing now is the people who haven't been infected with Omicron largely becoming infected because of that waning immunity.
Professor Nancy Baxter has also been studying the spread of the virus and says the current wave is being driven by several factors.
One is we have a new subvariant, BA4 and 5, that are able to get around our immunity from having had COVID in the past. We also have, this back to normal, so we're all back at work, we're going back to school, no one's wearing masks.
On Tuesday, Victoria's Health Minister said she'd rejected advice from the state's acting Chief Health Officer for a mask mandate.
I made a decision based on the advice that I had received that further mandating of masks was not the most effective way to get the message out about the importance of mask wearing.
I was incredibly supportive of those measures in 2020 and 2021, but I think we've moved to a phase where we can take more individual action, we can get the messaging right without changing the way that society sort of goes about their life.
What we've all seen is as soon as mask mandates were removed, everyone stopped wearing their masks.
Do we need to bring back mask mandates?
So mandates are an important tool in the toolbox.
Professor Greg Daw says the focus now should be on increasing vaccination among higher risk groups.
But there's still a really large proportion of people that are dying who haven't had their 3rd or 4th dose. So we know how effective vaccination is at preventing severe disease. So clearly we need to do more to prevent those severe cases amongst the older population.
I feel that our leaders have dropped the ball. We've gone from a situation where we were having daily press conferences and we had advertisements on television, and we've gone from that to almost nothing.
Why did you decide to do this interview?
I feel that people in the community feel that COVID and COVID deaths is something that's not applicable to them. It's not going to happen to them. It happened to me. It happened to my kids. I lost their dad. I lost my life partner. And I really would like people to step up, and our leaders to step up and encourage not lockdowns but simple measures of people wearing masks responsibly.
The St John family is keeping Jeremy's memory alive through music.
He was so proud of them, and he'd be so proud of what they're all doing, and it's really devastating to think his life has been cut short really unnecessarily because of this virus.